Hi guys, this is Michelle Gravengood, and this is my Nursing Theorist presentation titled Treating the Whole Patient. So my nursing theorist was Myra Strine Levine, and she developed the conservation model, which are composed of four principles of inpatient client resources in 1967. And the four principles are known as energy, structural integrity, personal integrity, and social integrity. So the model is based on conservation, and conservation means to keep together, and it discusses how systems are able to continue to work even when they experience challenges. So the focus is on maintaining the wholeness of an individual based on these four principles, and we'll talk about that later in the presentation. So a little background about Levine. She was born in Chicago in 1920. She earned experience in oncology nursing. She was a director, supervisor, and clinical instructor. She was known for her publication, which was titled Introduction to Clinical Nursing, and she passed away in 1996. So she had a lot of different experience in a lot of different areas of nursing. Some interesting facts are that Levine developed an interest in nursing due to her father being frequently ill and requiring daily nursing care for his gastrointestinal problems, which I thought was really interesting. She worked as a private duty nurse in the U.S. Army, which is how she started out in nursing, and she wanted to start moving away from nursing care that was heavily focused on procedures rather and wanted to move towards active problem solving and individualized patient care. So, more about the conservation model. The goal of the model is to promote adaptation and maintain wholeness. It's based on the principles that we talked about, known as energy, structure, personal, and social integrity. Every individual is unique and has a range of adaptive responses, and some major concepts of the model are known as adaptation, wholeness, and conservation. So, adaptation means that an individual is able to respond to challenges. It's how they respond to those challenges. Wholeness refers to the entire patient. So, our job as nurses is to provide the patient with nursing care physically, emotionally, and spiritually. And conservation, as I talked about prior, means to keep together or adapt. So, conservation and adaptation can kind of be used interchangeably. So it means that a patient achieves balance through their internal and external environment, and we'll talk about environment more later on. So, more about what each principle means. So, conservation of energy means that energy is balanced in and out of the body to avoid fatigue. And conservation of structural integrity means that you maintain and restore the physical body to help promote healing. And conservation of personal integrity is the patient's need for that recognition, respect, self awareness, and self determination. And conservation of social integrity is how a patient interacts in their relationships with other people, like their family, their community, and their religion. So the model continued. Um, Levine believed that the 9 models of guided assessment help shape the 4 principles of the conservation. So, this is just basic nursing care that can help us achieve those 4 principles that I just talked about. So, vital signs, body movement and positioning, hygiene, specific nursing interventions, nutritional needs, pressure gradient system, the application of hot and cold, administrating medicine, and establishing an aseptic environment. These can all help achieve those principles. So, some major concepts more in depth. So, the environment. Levine believed that environment played a huge role in the conservation model and the treatment that a patient receives. So, an internal environment means that it just refers to the physiological aspects of the patient, like their bodily functions. However, the external environment is broken down into 3 separate categories known as perceptual, operational, and conceptual. So, the perceptual external environment refers to how a patient responds with their senses, so light, sound, touch, temperature, things like that. Operational is elements that physically can affect individuals, but are not necessarily perceived or recognized. So, like microorganisms, we can't really see them, but they obviously affect us in many ways. And then conceptual consists of a person's environment, like their culture, their ideas, their values, and their beliefs. So, she believed that environment played a huge role in nursing care as well, and we need to be sensitive to that when providing nursing care to patients. And then there is another concept of her model known as an organismic response, which refers to how an individual adapts their environment based on the different levels. So these levels are the fight or flight, inflammatory response, the response to stress, and perceptual awareness. So all of these different categories make up how a person responds to different challenges. And that's basically what Levine was trying to say. So, how can we use this model in nursing practice? So, conservation of energy means that we just need to provide a lot of rest for those patients. Obviously, proper nutrition, high protein if they're needing to promote healing, and obviously adequate exercise and not letting them lay in bed all day. Structural integrity, you're going to want to provide those range of motion exercises to prevent muscle breakdown, provide personal hygiene like bathing and oral care, and you're going to want to change positions every 2 hours. Personal integrity is really just respecting their personal space and allowing them to have that personal space and making sure to ask permission before you perform those invasive procedures because we all know some patients can be sensitive to those types of things. And then conservation of social integrity, that is like the social interaction time with family and friends. So we really want to make sure we prevent social deprivation by allowing them to use the TV, the radio, maybe even leaving the door open so they can kind of see what's going on outside while still maintaining that privacy. And then provide support to the family by educating them and providing frequent updates of the patient's status, especially now with only one person allowed in the room during COVID. So, to conclude, Levine believed that each individual is unique, and it's a nurse's job to promote wholeness through nursing care based on those four principles we talked about. The key component to Levine's nursing theory is conservation, and that just means that a patient is able to overcome obstacles, adapt to situations, and maintain their uniqueness. Conservation is maintaining the wholeness of a patient and providing nursing care to meet those needs. And the overall goal of nursing is to recognize, assist, and support the adaptive process that can benefit the patient during challenges. So Levine really wanted to focus on that, the wholeness of the patient, and not just performing procedures, but really looking at the big picture of the patient and what's going on. So some questions I have for you guys are, what other examples of nursing care would fall under each of the four principles that I mentioned? Because there's a lot more than what I just mentioned previously. And then what may be the consequences to the patient if a nurse didn't include the conservation model in his or her nursing care? What might happen to them? And here are my references. Thanks for watching, guys.